Welcome to Raaonline. Today we are going to discuss liver function test. I am Dr. Sukanya. I am Senior Assistant Professor, Government Stanley Medical College, Chennai. Now we know liver has two important functions. That is, it does detoxification and it also has biosynthetic function. It synthesizes certain substances, especially albumin and coagulation factors. So liver function test is based on these two. That is, there are tests which are based on detoxification and excretory function of liver like serum bilirubin, urine bilirubin, blood ammonia and serum enzymes. And there are some tests which measure the biosynthetic function of liver like serum albumin, serum globulin and coagulation factors. We will see them one by one. So first is serum bilirubin. Now to understand this, you should understand the bilirubin metabolism. So where do you get bilirubin from, or what is the source is the red blood cells. Usually the senescent red blood cells, the heme and the globin component is broken down and that heme is converted by the enzyme heme oxygenase into biliverdin, which is then reduced by biliverdin reductase to unconjugated bilirubin. So that is the first step which takes place in the macrophages, reticuloendothelial system of liver and spleen. Okay, so from heme you get formation of unconjugated bilirubin or indirect bilirubin. Now this unconjugated bilirubin is then secreted into the bloodstream where it combines with or it is complexed with albumin. It is bound to albumin and it is circulates as unconjugated bilirubin albumin complex, which is called as an indirect bilirubin. And now this unconjugated bilirubin is then taken up by the liver, where in the presence of the enzyme uridine glucuronal transferase, unconjugated bilirubin is conjugated into a direct bilirubin. You have to understand this unconjugated bilirubin or indirect bilirubin is lipophilic and it is not water soluble. So for excretion to happen, it is converted into a water soluble form, that is direct bilirubin, which happens by conjugation. And this conjugated bilirubin is then excreted in the bile. So this is an important rate limiting step in the bilirubin metabolism, that is secretion of conjugated bilirubin into the bile. So that happens where in the gut it is converted further into urobilinogen, of which 80% is excreted in the feces as stercobilin, around 2% is excreted in the urine as urobilin, and remaining 18% it enters enterohepatic circulation back into the liver. So this is the fundamental metabolism of bilirubin which we have to understand. Now what is the normal value of total serum bilirubin? It's 1 to 1.5 milligram per deciliter. And when do you call it as indirect hyperbilirubinemia? If the direct acting fraction, if the conjugated bilirubin, in other words, if it is less than 15% of the total bilirubin, then you say the whole of the bilirubin is to be indirect. So this is the only important thing which you should know in bilirubin. When do you say it as indirect hyperbilirubinemia? So when the direct fraction is less than 15% of the total bilirubin, we say it is predominantly indirect hyperbilirubinemia. Okay, and the upper limit of normal for conjugated bilirubin is 0.3 milligram per deciliter. Because in most of the liver diseases, both conjugated and the unconjugated fraction of bilirubin tend to get elevated. Okay, so except in the presence of pure unconjugated hyperbilirubinemia, mere fractionation of bilirubin rarely is helpful in determining the cause of jaundice. So just we say direct bilirubin is elevated, it can be elevated in bilirubin, it can be elevated in hepatological disorders, it can be elevated in bile duct diseases also. So just with elevation or with fractionation of bilirubin, you cannot diagnose or you cannot assess the etiology of jaundice. But then why is it important? It correlates with a poor outcome. So disease outcome, there is various scores are there like MELD score or the Madrid's discrimination score. So these scores, they use bilirubin as a component to estimate the survival of the patient.